Dr. Scott Atlas spent months behind the scenes at the Trump White House in the early days of the coronavirus pandemic. All that time, conflicting information, guidance, competing egos, and what he says is a poor understanding of the science. That dominated the COVID task force led by Dr. Anthony Fauci. Dr. Atlas lays it all out in this latest book, which I hope you will get if you wonder what really was going on. This book tells you. It's called A Plague Upon Our House, My Fight at the Trump White House to Stop COVID from Destroying America. Please welcome to the show for the very first time, one of my heroes in this whole battle, Dr. Scott Atlas. Dr. Atlas, great having you here. You weren't a political person, you were a doctor. You suddenly found yourself thrust into an environment, and I think it was probably shocking to find out that there were people, that it wasn't all about COVID, it was about position and posturing.
Well, that's exactly right. I mean, I accepted the obvious, which was when the President of the United States asks you to help the country, the answer is yes. It's not even a question. And I was shocked at what I saw. It was very different from the typical, from what we were fed as Americans, that there were these experts that were scientists that were focused on being very critical about what was published, looking at the data in detail. I saw something quite different from that. They weren't prepared. They didn't know the literature. They weren't knowledgeable. They weren't critical thinkers. They were, frankly, bureaucrats. These were people who were in their positions for 35, 40 years. And, the way you succeed and keep those kinds of positions in government is really not because you're an expert or apolitical. It's because you're skillful at navigating a very political position.
So there were a lot of things that we were told. The biggest thing was follow the science. And at one time they said, don't wear a mask. They're dangerous if you don't know what you're doing. And then a little bit later, you better wear a mask or you're going to die. So what was this real science of all that?
Well, the science about masks actually for the general population was known in May of 2020. And I didn't get to the White House until the beginning of August 2020. So for months, actually years, we knew the science. The CDC published it that said that general population masks do not protect you from getting infected, and they don't stop you from spreading the infection. That was known with influenza, which is basically the same size virus. And the data throughout the pandemic really was showing that the mask wearing did not stop the spread of the infection. And then the studies were finally published, which were actually difficult to publish in the journals. Later in November, this was a study from Denmark that proved that population masks do not have any the people wearing the masks do not have any difference in their incidence of getting the infection compared to people not wearing the mask. This was a randomized controlled trial. It was then validated at University of Louisville, where they looked at all the masks wearing in the United States during 2020, and they proved that it did not change the spread of the infection, it did not change the incidence of the infection. That was known, but the narrative and the fear was actually took over. Rational thinking was gone, and anyone who actually said the truth was demonized or vilified. And frankly, that's not science. That's really, I don't know if it was all politics, it was simply irrational thinking from fear, but they tried to stop the information, stop the discussion, including, as we know, the emails that were released of Francis Collins, the head of the NIH, and Dr. Fauci, who were trying to, quote, take down all opposing scientists instead of engaging in the scientific process, which is looking at the data critically.
You came under an enormous level of criticism. That must have been a shock. You're a practicing physician. You're one of the world's leading authorities on such things as MRI, and suddenly you find yourself being questioned by somebody that works at CNN, for heaven's sakes.
Well, that's true. The media was particularly vicious here in the United States, even more than other countries. I mean, I had been in health policy for more than a decade, full time. That's what I do, is analyze the research and try to figure out solutions to complicated healthcare problems. And so when I entered, I wasn't prepared at all. Obviously, I was naive. I thought, well, we're going to talk about the data because frankly, no matter who asked me to go, the answer was yes, because people were dying. the Fauci and Dr. Birx's policies of lockdowns were failing. And so the country was in a state of panic, and it wasn't political at all. But when you get there, as soon as I was introduced, there were hit pieces by the Washington Post, CNN. And frankly, we're in a position now where we can't really trust the media. We knew that then, but we now know that we cannot trust people simply because they have credentials or a title next to their name. We have to become critical thinkers as adults. We have to look at the information. We have to figure out who we can trust, who is speaking about the data and consistently. And we have to take the responsibility really as individuals to make the best decisions for ourselves and our families. We cannot let that sort of be a passive process. We have to become active, critical thinkers ourselves.
One of the most, I think, profound things that I heard someone, a medical doctor, very qualified, and he said early on, he said, this is the first time in human history that in a pandemic, we isolated the healthy people instead of just isolating the people who are sick with the disease. And I thought, gosh, that makes a whole lot of sense. So we shut down the entire country, all the economy, except we thought you're safe if you go to Walmart, but you're not safe if you go to church. That was weird.
Well, I mean, it's completely illogical, first of all. I mean, that's one of the things that we know is that it was simple logic. It wasn't very complicated to figure out. We know who's at risk. We know who's not at risk. Let's focus. This is what I said, targeted protection back in March of 2020. Let's focus on protecting the people who have a significant risk to die and stop the destruction of children and younger people who do not have a significant risk to die. But all logic went out the window. And frankly, as you just mentioned, people don't realize this. Standard pandemic management was known 10 years before this pandemic to be that lockdowns don't work and lockdowns are destructive. So they're not part of the way you manage a pandemic. But somehow, possibly because it was an election year, it's hard to speculate as to motive, but we started locking everything down at the advice of Dr. Fauci and Dr. Birx, the head of the medical side of the task force, with this really irrational view that you could stop the spread of the virus or even eradicate the virus and they frankly never spoke once about the destructive impact of the policy. This is one of the biggest failures, in fact, one of the most unethical uses of public health leadership in modern history, where they said, we're going to stop COVID-19 at all costs and not care about the impact of the policy. So this is really, we can never let that happen again.
Well, I hope we don't let it happen again. I'm not sure that Americans would ever just surrender their every moment to government bureaucrats again. If there were things in the media that I found just unbelievable. Donald Trump was accused, for example, of encouraging people to go and drink bleach. He never said that. You must have been frustrated at times to read something in the paper or on one of the networks and find that had no basis in fact.
Well, I mean, this was a repeated problem in the media. I used to think that the media was going to be inaccurate and criticized, but I never realized that they frankly completely make things up. And this was standard practice. In fact, I mentioned this in my book, but when I first got to Washington, the president called me on the phone and we had a conversation about many things. And he said, well, Scott, you're going to only learn one thing from me, and that is how vile, how the media is, how much they lie. He said, that's what you will learn from me. And again, he was right. He was right about many things, particularly that one.
If you had it to do all over again, would you still have gone to the White House, and would you have gone with different conditions of going to be an advisor on the pandemic to the president?
Well, the answer is there is no other choice besides to go. It's my country.
Yeah.
Okay, people are dying. We had the wrong people in charge of this pandemic policy. So, of course, you have to go. There is no other choice. And there are no conditions, really, because there were no conditions because I'm there to provide answers to the president, to help him navigate this crisis, to explain to people in sort of layman language, the science, and reassure people that people there know what they're doing. And so I don't think I would do it any other way. I would be less naive. I would warn my wife of what's going to happen. I would tell my kids, but frankly, you know, there is no other answer to this. The answer is yes, and I would like to add that we must pray that we're not a country where good people are afraid to step up. That would be a disaster.
Dr. Scott Atlas, thank you. Thank you for all that you've done to serve the country and bring some common sense to all of this. I hope you'll get your copy of Dr. Atlas's book, A Plague Upon Our House. It's available everywhere books are sold. It is a phenomenal read, and it is eye-opening. And if you've had any questions about how this whole thing was managed, this is the book you want to get, and I hope you will get it. Get an extra copy and give it to somebody who still thinks that you ought to wear a mask everywhere, even outside or when you're by yourself in your car, because that seems weird. To learn more about Dr. Atlas, head over to Huckabee.tv.